All right, so why don't we get started? So welcome everybody. I'm David Ellis. Welcome to a joint Zoom call. This is a mix of LTC 100 Intelligence Group and Senior Living 100 Intelligence Group. And this is a Zoom call on vaccination best practices. So what I love about this call is we're all living this in the moment. It's a big deal, and we are going to share and learn from each other. And we're recording this call, so we will send you a link to this. So if you'd like to share what we learned today with anybody, somebody has some noise there, please keep that down. If you want to share this with your team, we're going to send out a link either later today or first thing tomorrow, so you'll have this recording. Okay, so before we start, just a couple calendar things. So coming up the next 2 weeks, next Wednesday, we have an epidemiology video call. You guys should have gotten a calendar invite, but if not, you'll get one. We have 3 epidemiologists. That's next Wednesday, January 20th, 4 to 5 p.m. So save the date. And that's on this new COVID variant. So we have 3 epidemiologists who are going to tell us what is this new British variant B117 likely mean for community spread of COVID in America. And we also have a number of health systems on that call. We're going to talk about what they think it means for the health system sector. And spoiler alert, we think it is a big deal. We think it's going to mean some real difficulty for our health system sector ahead as we get later in this winter. So that has ramifications for us in post-acute. Secondly, on the week after, Tuesday, January 26th, we have a think tank call, and that one is similar to this one, but on that one, we're looking ahead. The topic is using vaccination to restore resident quality of life, and what are we doing to start marketing that to improve both occupancy and our staffing situation. So using vaccination to improve quality of life, thereby seeing if we can solve our 2 biggest pain points in both sectors, which is staffing and occupancy / census. Okay, so with that, let's dive into this topic, which again is vaccination best practices. So I think we're talking, we can talk about resident vaccinations, but I think the bigger challenge we're having is on the staff side. So we're picking up a bit where we left off just before the new year. So yeah, so we'll just sort of start wherever we like. Let's try to keep it concise. We have a whole lot of participants, so I'm really eager to hear what people have to say and would love to get a lot of people sharing here. So we basically want to learn what's working, and I guess I'll tee it up with this thought that we've heard a range of ways people are going about vaccination, from sort of gentle encouragement and communication to incentives to vaccinate, to disincentives to not vaccinating, to making it mandatory to vaccinate. So we'd love to hear from those that are finding success, what is working. And as we get along with it, any questions people have, we can get into that too, asking each other questions that relate to this. So who wants to start? Who's having success and what seems to be working?
I'm happy to start. This is Jody Guffey with Radiant Senior Living.
Great. And please, when you speak for the first time, let us know where your footprint is. So Jody, Radiant is roughly how big and what states are you in?
Right, we are kind of a Mountain West operator, 17 communities, 6 Mountain West states.
Yep.
IL, AL, and memory care.
Right.
Let's see, we've been about, well, I think we're about 6 or 7 first clinics in, and we had a particularly high adoption rate at one community, and we had our executive call today to kind of discover what that was, why that success was. And it really had everything to do with the leadership. Taking a few key leaders and really having them be the cheerleaders to go around and educate everybody and to validate their fears. Really just let them know that those fears are real to you. And so if we can take an educational approach to what is behind those fears, and then how do we make sure that we address those, but then give them the educational component to it. So for example, I'm concerned about infertility. Well, scientifically, this vaccination cannot penetrate the nucleus of the cell, and depending on who it is, just really education. We've put
So Jody, sorry, if I can just address that. So when you say leadership is the difference, are we talking sort of strategic plans they put in place to educate? Or are we talking more about sort of tactical one-on-one, walking around, meeting individually with people to reassure them?
Right. Yeah. Great question. All of the above. We started, with the corporate office. I'm putting together town halls each week with any updates, and then that is sent through our payroll system that assigns that to every employee. So they're hearing the latest and greatest information each week. And then, it's a required listening or reading with a quiz, those kinds of things.
But Jody, you're seeing a big difference between facilities based on the facility leadership?
Yeah, yes, very much so. And so on our executive call today, I asked that community leader, what do you think it is that made your adoption rate for your employees, for example, was above 85%, and your residents was close to 98%. So why was that? And this executive director said it's very much about just constantly, every single day, without pause, management by walking around, but having those conversations constantly.
Yeah, that's great. I want to remind everybody, if you're not on mute, we're picking up any noise. So please don't speak or have noise if your mute button's not on. Okay, other sharing. Thank you, Jody. Great.
David?
Yeah.
This is Greg Colliner. Hello, David.
Hi,
I can just play a little bit off of what Jody's message is. I completely agree with that.
So hold on, Greg. For those of you who don't know, Greg, we have a lot of senior living folks who don't know your footprint. Yep.
Yeah, so Alter Care Integrated Health Services, we operate 25 skilled nursing facilities in Northeastern Ohio with one facility in Michigan. So we've completed 25 first clinics. We've held 7, I believe now, of our second clinics. We had a really slow start, David. We started out with all in 60% of our residents being vaccinated, 30% of our staff. Now the second clinics, we've moved that number to 92% of residents and 63% of our staff. And leadership is key, but I would define it this way. Leadership, administrative leadership, who finds ways to aggressively connect decision makers with clinicians, meaning medical directors, attending physicians, nurse practitioners, carrying that conversation with decision makers for both patients and then individual staff is how we've really moved the dial.
So Greg, you're saying when people have questions, they are reassured if they're talking to medical professionals.
Yes, and we've accomplished that through roundtables that we've held with staff and clinicians. We've accomplished it through Zoom meetings with individual decision makers and again, clinicians, nurse practitioners, and physicians as well.
Greg, do you think that 63% will go up quite a bit more on the next round, or do you feel like it's tapering off?
I think it will continue to improve even through the remainders of our second round clinics to be held yet, David.
Okay, that's great. Thank you, Greg.
Yep.
Others?
This is Tammy Royal with Beacon Health Management. Can you hear me?
Yes, we can, Tammy. Yep.
Okay, I'm driving. I happen to be leaving a building, so bear with me. So all of the above we are doing with Beacon Health Management.
Tammy, hold on. Where is Beacon? Where is Beacon and how large are you?
Okay, Beacon Health Management is based in Tampa, Florida, our home office, but we have 17 Georgia SNFs that's all in rural Georgia.
Yep.
One of them being a 10-bed vent unit and a SNF. And I have to agree with everything that we heard, the leadership. It starts with leadership, not just leadership at the centers, but leadership with the management company. I'm the Senior Vice President of Operations, and I've been boots on the ground trying to get to the buildings, and I'm also a nurse and educate. I have my whole regional team that's doing the same, getting to the centers and answering questions of those who have fears. And, you know, we've had to explain even to our leadership team that these fears are real fears. And, you know, we can't just dismiss those. We need to find out what they are and try to educate, as both folks have just talked about. We're doing the same thing, but we have had, out of 17 centers, we've had 12 centers receive their clinics, and most of those are around anywhere from 10% to maybe 18% of employees. I did have one building that was 50% of the employees, and that building was hit really hard with COVID. And I think we had about 68 residents and about 30 employees that were positive. So I really think that working through COVID maybe helped those folks to step up to get the vaccine, but it's nowhere near what we would like. So as far as incentives, we've tried different things, and it's been a multitude of things that we've tried. And it seems that every little thing we try is helping, but it's nowhere where we would like it to be. But we have, I sent a letter from myself to all the buildings, just, you know, giving a testimony. I have not had COVID, but I have been vaccinated, and just shared some clinical experience with them and taking care of COVID patients. I had my regional nurse. She also sent a letter to the employees, and these are posted in the building. And she has really strong allergies to almost anything you could think of. And she is doing well. We sent pictures of our vaccine and administrators.
Tammy, you're starting to break up. I'm going to cut you off there because you're breaking up, but we got the gist of that. So I want to thank you. Great stuff. Great. So
thank you.
Yeah, thank you, Tammy. Okay, others. What's working? How are you? What are the results you're finding, and what's working?
David Jones Seller from Monterey Home Communities in Lancaster, Pennsylvania. We're a single site CCRC with about 850 total residents. Our first clinic, we had 42% of staff, and essentially 100% of our skilled nursing residents agreed to receive the vaccine, which I was delighted with, because I personally had a little fear that we would have some anti-vaxxer children. But essentially 100% of our skilled nursing residents got their first dose. Yep. Ironically, 2 of those residents tested positive for COVID this week. So just because you have your first dose on board doesn't mean you're out of the woods. They're asymptomatic, but they were positive this week. We had 42% of our staff with the first clinic. Our second clinic is 10 days from now. And we have 60 new staff that have agreed to have it with the second clinic. So we're up to about 60%. Obviously, we'd like to see that number continue to go up, but we've just done the strong encouragement route, and lots of one-on-one conversations, you know, connecting staff with people that know, and that's the route we've gone thus far.
That's great. Thank you, John.
I have a question for John.
Yeah.
Please.
So John, you said that one of your residents then actually got COVID after the second vaccination. Do you think that's because they were already maybe carrying it, or just because they were not yet fully immunized?
Yeah, we don't know. And I want to be clear, they just had their first vaccination. They did not have their second one. We've had 9 staff exposure cases since the beginning of the year. 6 of those we know for sure were community spread. The other 3 we were not able to contact trace directly. So we're not sure, but one of the residents actually had COVID back at the end of March of last year as well. So this is the second time she has tested positive.
And did any rumors start circulating that maybe they got the COVID from that vaccination?
No, I don't think we've had to deal with that. We've been really clear about that in our communication.
We had that happen one time. That's why I asked the question.
Yep.
Great. Thank you, John. Jody. All right, who else wants to share? I see Scott Pilgrim. I see Steve Flatt. We've got some interesting folks we haven't seen in a while here. Anybody?
I can go. This is Scott Pilgrim. I'm with Diakonos Group.
Hey,
we have 22 buildings all in the state of Oklahoma, and it's a mixture of SNF, AL, one IL, and several ICF IIDs. We have, within the next 3 days, we will have all of our facilities through round 1 and about 2/3 of our facilities through round 2 by the end of the month. Our first clinic, we had about 35% staff uptake and well into the high 80s for resident uptake. One of the things and since then, it's been a mixed bag from, 45, 50% in round 1 to one building that had 90+% of staff take it in round 1. We've
So Scott, what was going on in that building? What explains that?
It's a rural building. They were one of the later round 1 buildings, so they saw, and we videoed myself taking the vaccine and made kind of fun with it a little bit. After the vaccine and actually all the media left and the governor left and all that sort of thing, I popped an Alka-Seltzer in my mouth and foamed at the mouth. And having fun with it. This was my deal. I tried to find a little ear that I could grow a third ear.
That's our biggest best practice. I love that. Alka-Seltzer foaming at the mouth. I can see that one. That's great. We got to write that one up.
It was funny. My senior staff just looked at me, and the CVS people that were there at the clinic just kind of freaked out for a little bit, and they said, "Don't pay him any attention." But there's nothing wrong with him. But anyway, we filmed it and had fun with it, and we've tried to make a mixture of education, because every day we're fighting the stupidest person on Facebook, because that's where our staff gets their information.
Yep.
So we try to hear those rumors and say, no, in fact, if you get it, it doesn't cause you to have to develop the disease. It doesn't, there's a lot of OBGYNs now are actually advocating that pregnant or to be pregnant young ladies get the vaccine. We're not trying to give you medical advice. We're saying talk to your doctor in those particular circumstances. And one of the things we're doing is we're still paying hero pay at 20% above their base wage rate. And in January, half of that hero pay is contingent upon you taking the first round vaccine.
Wow.
And in February, 100% of that hero pay will be based upon whether, the initial criteria to get the hero pay is that are you vaccinated?
So some disincentive there, basically you're putting in some disincentive to not vaccinating, which I love. I think we've focused a lot on the carrot, and I think a little bit of stick mixed in, my own view, I think makes a little bit of sense. So I actually love that. But I want to key off that humor thing. I wonder if that's sort of a really interesting way to go about it, because of course people are afraid, and fear is based in, it's a real thing, right? But if you can inject some humor, right, humor takes away fear, right? Fear is about scary stuff, but if you're finding humor in it, psychologically, I think it's powerful, right? I mean, I
absolutely agree with that.
Right? It's not as big a deal. It's not life or death. We're making light of it. So therefore, let's not get all worked up about it.
Right? Humor and transparency.
Well, not to minimize any other effort, but it's the first I've heard about humor and making light of it. I just want to highlight that. Yeah. Transparency, of course, big one. Yeah. Thank you, Scott. Other feedback.
This is Erin Hennessy from Health Dimensions Group. We are 32 communities in 8 states, a mix of skilled, assisted housing, memory care. We used the joyous humor, balloons, videos, making it a really fun thing. And you talked about fighting with the stupidest person on Facebook. We had a comment about that. We've gotten a lot of feedback from local leadership about, if you've seen what's on Facebook, that's what we're constantly fighting. So we actually started doing Facebook messaging for putting videos on Facebook for our staff to share and be involved in. So we decided that instead of just fighting Facebook, we'd get on there with our messages. So all of our communities that have had their first clinic have a video of what the first clinic looked like, people's reactions, a thank you to the CVS team. So we've actually kind of put ourselves on Facebook in hopes that the people who didn't vaccinate in the first clinic, when they go on Facebook to read everything, sign up for the second clinic. So that's really been one of the strategies we used, was actually just to get right on there with the bad information.
I love it. Erin, how are things going? Any results to report?
Oh, you know, ours is really a mix. Geography is a huge difference. I mean, state to state, rural to urban, just so different. Some of our communities were as low as 20% staff, some were as high as 60. Residents really consistently 95 plus. Our residents have lived through vaccine preventable illnesses, so they get it. I'd say it ranges. The communities that have been the most successful are the ones that have really been pushing it beforehand and actually having people fill out the paperwork beforehand. So we actually have a checklist, and we actually have them turn in their paperwork. And then if they don't turn in their paperwork, they get calls, they get emails. So our most successful clinics, I think, were the best planned by local leadership. We're using the word, you're obligated to take it. We're not saying mandatory. We're saying you're obligated to do the right thing by your residents. So, you know, for those, in some cases, 50% of staff who haven't done it, they actually have to sign a declination form, talk to their manager. So we're not at the end of the day pinning anyone down and vaccinating them, but we're definitely making there be a few steps to say no. But still hovering, I would say on average about 50%, which I'm sure like all of you is keeping you up at night. I've been at a lot of our clinics just begging people to take it.
Erin, if you could flash forward a couple months, where do you see this going? Do you see it continuing to be an encouragement campaign, or do you see yourself moving more towards obligatory/mandatory at some point?
I think encouragement. I saw today Dollar General is paying every employee 4 hours to come get it. So they're not actually paying them for the vaccine. When you come in, you get paid 4 hours for getting there and getting home. So a little bit different. We've talked about doing challenges so that if the building with the highest success rate gets a new break room, that's one that we're looking at doing. So I think incentives right now, we've obviously toyed around the idea of making it mandatory, and there's just so much out there saying you're at risk. I would like to do that, but we've had a lot of people tell us we shouldn't, especially around work compensation.
Yep. Okay, great. Thank you, Erin. Okay, others. Feedback. Hi, Ann. Welcome.
Hi, my name is Ann Doyle. I'm with the president of LaSalle Village. We're on a university campus in Massachusetts. We, like all of you, have taken the education route, but many of our employees who have cultural backgrounds that are not from the US were very hesitant. And we did a lot of education, and then I realized, wow, this is going to be slow. So we asked staff what was most important to them, and they said time. So everybody who vaccinated on the first day clinic got an extra personal day, which was incredibly successful and bumped our rate up to 75% on the first day from what was much lower when we started. We have we've now vaccinated all of our residents, 100% of our skilled nursing, 100% of our AL, and 99% of our independent got vaccinated on the first day. We use CVS. We were the second day in Massachusetts of any of the skilled nursing getting vaccinated, and it was extremely slow. The second vaccination clinic, we offered in advance to enter the data into the system ourselves, and it just went so quickly. So now I have hope for the world that this can actually happen. But that incentive was very, very popular.
So a personal day off. That was the key. Yeah.
And they can use it any day between now and the end of the fiscal year for us.
Okay. That's probably a little challenging for some because staffing is such a tough thing right now, but I guess you figured it'll work itself out in the wash, and you took a little risk there, no doubt.
We did. And I also talked to a lot of groups of staff, individual staff who were very important to talk to. And I said, ultimately, this won't be the place for you to work. We really hope you'll choose to get vaccinated. Like Erin, we were careful on the language, no mandated, but really wanted to let people know that this was our culture.
Yeah, that's great. Thank you, Ann. Monique. Thanks, Ann. Monique.
Yeah, so I'm Monique. I'm the COO for post-acute care at Evergreen Health, and we were the hospital facility that received all of the patients at the first nursing home back in February. where we found the community acquired. We have about 9 facilities that are in our network, one of them being that facility that's been all over the news. And for that facility, they received their CBS vaccinations, the first round on 12/28, the Pfizer vaccine, and are set to get their second dose. We had, I think, 87% of the staff and 93% of the residents in the facility take it at the first time. One issue that one of our facilities had was I think the CVS pharmacists that are coming out, they all have a little bit different experience and a little bit different information. So there was a question of, well, if you've had COVID before, do you have to wait the 90 days? And in that facility that we mentioned, what we pushed for and what was ultimately happened was to say if they're outside of their infectious period and they've recovered, that they were given the vaccine, as well as one of the other facilities was told by the pharmacist that they would not vaccinate the rehab patients, only their long-term care. And that all of the rest of the facilities within our network said that's not accurate. I would reach out and get them back. But when you don't know what you don't know, and someone tells you, nope, we only do long-term care because the rehab are going to be gone. But what we've been working on is how the flow is going to be for those rehab patients that have been discharged. What's our process for calling them back in? And at least a few of our facilities are working on a drive-by vaccination for those rehab patients that have been discharged, but at 3 weeks need to come back in. And the plan is to do them in the morning to make sure we have the booster vaccinations to get all of those people done and then move into the facility. We also found that some of our facilities were finding that if you asked before and then you asked for the number of patients and staff that were willing, that once the vaccinators were in-house, a whole bunch of other people raised their hand and said, I want it. So the recommendation was to ask for more than you need, because what was happening is they didn't have enough to vaccinate all of the patients and staff that came out of the woodwork that said, I changed my mind, can I get it today?
Monique, thank you. A couple questions for you. So to be clear, you don't own these SNFs, right? You're a health system that has a network of post-acute SNFs. I'm curious, do you have an average percentage of staff? Do you have a sense of what the average is? You mentioned the Kirkland facility, which is really high, 87% of staff. Kirkland was the first outbreak in nursing homes, as you guys may remember back in February. But overall, in your network, what are you finding among staff vaccinations?
So let me just make sure. Am I on mute? Can you hear me?
We can hear you. Yeah.
Okay. So just kind of looking across, I'm seeing, 73% of staff. What I was told for the other facilities that weren't that facility is that they were seeing about 70 to 75% on the first time, but we are still seeing anywhere between 80 and 100% on the patients for other facilities.
So 70% is really high. Is that just the state of Washington? It's just sort of culturally in the state, do you think, or is it those facilities? That's higher than we're hearing from the rest of the country, generally. You're on mute now.
The lowest that I see looking at all my facilities is a 63% on first vaccination.
Well, really good.
And you're running all skilled, correct?
You're talking about the facilities, whether they have skilled and long-term care in them?
She doesn't run these. This is just a health system. Monique is a health system. Evergreen is a hospital health system. That this is their network of post-acute they discharge to. Okay,
so much more clinical. I would say that what I've seen in the industry and with our skilled partners is that there's been a much higher adoption rate, at least over here in the Mountain West states, in skilled. And as we talked through that, we thought the likelihood was that in the skilled environment, the higher adoption rate with staff had to do a lot with these individuals probably have a higher skill set and knowledge and understanding, and are seeing the face of COVID in the more very, seeing the real bad side of it. Whereas in community-based care, there's more skepticism and they're not seeing how bad it can be.
And because it's
let's-
regional, I mean, as you mentioned, I think because we were first hit last February and hit very hard, particularly in these facilities and around the region, you know, I do run our home health and hospice, and I think we have about 8 or 9% at this point that have said they are not interested in getting the vaccine. And we've vaccinated, I think, over 80%. And we have some that are waiting maybe for the 90 days post-COVID.
Monique, this is of your home health staff. You're saying 80%?
Yeah.
That's also really high.
80% have been vaccinated, but we only
Really high.
we only
Really
have
high.
8 to 9% that have said no. The
Yeah,
others that are in the middle are just waiting.
I'll tell you, that's really high. So kudos to you. Let's move on. Thank you, Monique. Kevin McNamara, who are you with? Welcome.
Yeah, I'm with Transforming Age out of Washington, and I just wanted to add, we heard from Washington, we're seeing through our CCRCs, assisted living and skilled, about 70+% of team members and 99% of residents.
Yeah.
And I think with the team members, like everybody else, we've just focused on the education. The actual clinics were really clinic parties. They were vaccination parties. So a lot of food, drinks, prizes, unique. So far to us, not a lot of communities around us have been with their senior housing pharmacy. So our vaccinations have come through our senior housing pharmacy provider. So that meant that they were the ones bringing it to the building and preparing it, but it was our nursing leadership staff that were administering it.
Yep.
And so a lot of conversations ahead of the clinics were taking place between the staff members and the nurses who were going to be doing the vaccinations for them. So there was a pretty good trust level there. And we feel like that may have made a difference. We were able to start promoting it a little early. Our clinics started on December 23rd. And so we've just completed our second round and have seen quite a few more team members take it on the second round. And then a lot more people saying they'll take it on the third round.
Yeah.
But we also think that what we haven't run the numbers on, and maybe others on this call have, is I haven't had a chance to back out our on-call team members from these percentages. So we think when we back out our on-call staff or casual workforce, that we may be closer to 80%. And then, like all of you, trying to track down who's getting it from another employer who are part-time or on-call workforce.
Yep.
So that's
Kevin, are you with Consonis? Is that your pharmacy partner that you're referring to?
It is.
Yeah, that's ours too. Yes, it has had a much higher adoption rate.
And they provided a lot of material ahead of time, a lot of good videos from the pharmacist that we were educating residents and team members with. So I think that relationship definitely helped us with those numbers.
That's great. Thank you, Kevin. All right. Other thoughts of ideas that we have not heard yet? Any creative things that seem to be working?
David, this is Rob Liebrick from Goodwin House in Northern Virginia. And I think from a creative standpoint, nice to see you, Kevin, by the way. A creative standpoint, I think we've had a hard time getting doses and vials. We've had CVS as our pharmacy, but they've been limited. They only brought a certain amount. It didn't cover our whole base of staff and residents. So we've been knocking on doors with hospital partners. We've been knocking on doors of individual pharmacies these days. We just had a cold call from a local pharmacy that had 500 doses and wanted to distribute them out. And so we took them. So even though we're signed up with CVS later on, 2 weeks from now, we said we can get 2 weeks early, get all of our independent living residents covered. Let's do that. So
wow.
Unique standpoint, I think those are two factors. And then the other thing we're hearing from our residents and from our clients is they're not interested to have housekeeping services if the housekeepers haven't been vaccinated. They aren't interested to have hospice services if our nurses haven't been vaccinated. So we're starting to hear that already more frequently. And so certainly a mandate is forthcoming from us once we can get control over the vaccine. But it's going to be consumer driven.
Rob, sorry, I didn't quite understand that. Who didn't want housekeepers vaccinated? What?
No, our residents don't want housekeepers in their apartment if those housekeepers have not been vaccinated.
Even if your residents have been vaccinated?
Correct.
And is that fair? I mean, you could argue, well, you've been vaccinated, you're safe.
I think it is a perception that is going to be out there, and it's going to be really hard to fight against.
And Rob, do you feel like you have the, is that something you agree with? And this is a big question for everybody here, but as we go forward, once we vaccinate our residents and most of our staff, will the next step be to say anyone coming to our buildings, whether it's other providers or, whoever, yeah, you need to be vaccinated? Do you feel like, Rod, that's something you're going to do, and it's going to be maybe a way for you to pick who your best partners are? If you're home health, for example, and you're a hospice and you want to run through your building, you send me only vaccinated people.
Yeah, we operate our own home health and our own hospice. So absolutely, that's going to be a requirement from others for us. We can't go into other people's buildings if we're not fully vaccinated. Certainly, that's going to be the expectation.
Yeah. Okay, great. Other good ideas that are working.
We were able to actually bring in our third-party partners, our home health and hospice workers, to some of our local clinics because there's been an excess of the vaccination. The vials say they come with 5 and there's often 6 and 7. And we've just kind of told them, be on standby, be nearby. If there's more, they don't want to waste these doses. And we've been calling in the third-party providers, and they're getting the vaccination actually at our community.
I do want to shamelessly say, if anyone has any extra vaccine, there's 25 employees here in Connecticut that are dying to get it. So feel free to overnight it to us.
I can give you our clinic dates, David, if you want to come on out.
We'll do it. We'll do it. Okay, who else wants to contribute? Fresh ideas.
Hi, this is
Go ahead.
Tracy from Signature Healthcare.
Yes, Tracy, thank you.
So we have 110 SNFs across 10 states and a home health company in Florida. I wish I had some of the results that you all had. Ours have been somewhat dismal, at least from my perspective. We initially started with a survey to gauge the interest that was going to maybe come, and 40% said yes, they definitely wanted it. And there was like roughly 30 that were unsure, and the rest were like not having it. Unfortunately, our results haven't been the same. We came out of the gate with round 1 with about a quarter of our facilities, and we've only achieved 28% adoption. And much like you guys, we offer hero pay. We even have COVID pay and COVID designated units. And so we were kind of going down the carrot, to your point, David, the carrot road of how do we incentivize people to take it? But it's really what we're seeing is leadership does matter, much like you all said, because in some buildings where the leadership is a believer of vaccination and is part of the education, that's the person they trust. They don't necessarily always trust the home office or corporate level folks trying to educate them, but when it's their peers who believe, it seems to have some influence in the building. We did, similar to Aaron, do kind of the $5,000 for the new break room for the buildings with the highest percentage adoption, that kind of thing. We haven't really seen a lot of result from that. So we were on a call today, myself and my COO, talking about what other different approach could we take. We've talked to some other colleagues in the industry, and we're fearful of mandating. We believe it's the right thing to do, but fearful because of the staffing perspective. But then there's the flip side of we can't get census back if we're not a safe place to work and a safe place to live, right? So we're kind of caught in the middle, hoping that CMS or the Biden administration or somebody takes some action and mandates so that we don't have to be the bad guy. But what we decided is some of our folks are just not early adopters. And so Atria, who's assisted living, and MFA, Medical Facilities of America, they've mandated, but they also put kind of an extension on when the mandate is due. So I think Atria gives you until May 1st to get vaccinated. So it allows those not early adopters to kind of wait and see how their colleagues are doing, and it kind of quells some of that fear. So we're thinking that maybe we go with that approach, that we're not going to mandate immediately, but maybe give a timeline so that we're working towards it. But some of the fear is that I'm going to get sick, right? That I'm going to have some side effects, and they've already probably taken time off if they've tested positive once or had some symptoms. And we weren't paying for that. Many of you might have been, but we weren't paying when they were out. They could use their paid time off. So what we're thinking now, and hopefully this will have some impact, that if someone is symptomatic after taking the first dose, we'll pay for that time away that's absences related to the symptoms. And if they test positive after having the vaccine, we'll pay for that 2-week quarantine time period, so that gives them a little time to adopt, and then the fear of being without pay and without work, we can kind of eliminate that barrier. So a little combo. I don't know how that will go over, but that's the direction I think we're going to take next.
Tracy, I just want to say I love the idea of putting a mandate out there in the future. So it sort of says you guys are resolute and this is what's coming. So, and maybe there's even a disincentive. So, if you take it, or an incentive to take it earlier rather than later. So people will say, well, I've got to get on board eventually. Why don't I do it sooner than later? The other thought I just want to throw out there is I'm curious if somebody doesn't take the vaccine and they get sick and need to stay away from work or quarantine, do you still pay them normal pay, or is there anything you can do there to disincentivize that?
We do not. They would have to either use their accrued paid time off or take it unpaid. And many of them, we've allowed them to go on a leave of absence so that they could collect unemployment. And in some cases, I think they were filing for workers' comp, couldn't double dip, but we would essentially furlough them for that 2-week period if they didn't have any paid time off that they wanted to use. So they might get some support from the state. But we're thinking,
I just think creating some distance, creating some real disparity between if you don't vaccinate and you get sick, here's outcome A, versus if you do vaccinate and you get sick or away from work, a starkly different thing there might resonate.
We're hoping, and we're hope that'll send a message. And selfishly, it kind of gives me time as the CHRO with our talent acquisition team to identify who's completely out, like they're not going to do it, so that we can staff up to it. Because I'm just afraid right now, from our staffing perspective, if we were to mandate and people were to leave, it would put us in, obviously a precarious position there from a care perspective. And I don't want any more agency.
Tracy, I've spoken to a couple of community, or actually companies that are nationwide that are mandating. And one of them took the position of, we mandated it based on the fact that there was going to be a possibility we would lose a few people. But we also knew if COVID got into, say, one of our departments, we automatically have how many people that we're going to have to pull off the floor or out of the kitchen and whatnot to isolate for, a certain amount of time. And so they weighed the pros and cons with that, and knowing that they would have ultimately a safer environment with the risk that, they may lose a few people in the beginning, which I thought was a very bold approach. We aren't willing to do that this first round, but definitely considering it the second round. But I love your idea of mandating by a certain date. I think that's really genius.
Well, and I love the bold move too, Jody. If it were up to just me, I probably would have done it even despite the staffing challenges, because I think on the flip side, while it might be a staffing challenge up front, if you come out of the gate mandating, then everyone in those communities knows, one, it's going to be a safe place to work and a safe place to live. So census should naturally come your way, as should any new applicants, because if I am a vax believer, where do I want to work? I want to work where it's mandated, because I was the one who did the right thing. I want to be around other people who did the right thing. So I think if you're bold enough to take that leap of faith, I think it can prove to be beneficial. I was hoping to organize and collaborate with people across the industry to come out of the gate together and mandate, so that we could all take a strong position. But there's a lot of C-suite executives who are still relatively hesitant to take the step.
Yep, great, love it. Other thoughts, creative ideas, or let's open it up to questions anyone has about anything related to vaccination.
David, I was just going to share. I was just going to share one last thing that I forgot to add earlier. We ordered buttons to hand out at the clinic. So they're a nice big button that says, they're vaccinated. And so there's a little bit of good peer pressure that seems to be going on now with those who are wearing those buttons and those who aren't.
Yep.
Yeah, I was going to share that from the get-go, we created a theme. It was called Be First, just like
who was this? Sorry.
Oh, Pat Moran with Northbridge Companies. We're a assisted living regional provider. We run 19 communities in New England.
Hi, Pat. Welcome. Yep.
And we decided to create a theme right from the get-go, from the first woman in the UK who received her vaccine. And she said, somebody has to be first. And I picked up on that and we ran with it. And we treat, so we too have stickers. And the whole idea was to, create envy. Those first adopters, give them credit, sing their tune. We also I did 2 Zooms for the associates, and the first one was really more geared towards what is this? It was more kind of science, but at a level they could understand. And then today so that was about 2 weeks ago, and we put it out on OnShift. It's on our webpage. It's all, we know how many hits it's had. And so that if they didn't attend at the time of the first one was at 6:30 at night, that's the time they requested. So we tried to accommodate their schedules, put it out on OnShift so that they can play it back. And today I did the second one, and having had time to study why people are vaccine hesitant, some of the articles out there were really quite interesting, because the first time we really focused on do the right thing. It's the right thing for our residents. You're in healthcare. This is what we do. This is why we're here. But articles spoke to make it personal. And so today's presentation, the Zoom, even though I was answering some of the same questions, I made it about them and their family. And I was amazed, so pleasantly amazed. I got at least 10 texts telling me how many people saw that and already converted. It made a difference.
So Pat, when you say make it personal about them and their family, you mean instead of about it's the right thing to do for residents or community spread, saying it's the right thing to do for your own family so you're not infecting your loved ones?
Yes. And make it about them. And that's what all these research studies have said with this group of people who are the hesitant ones. There's a certain, they have all the research. CBS had good information that they sent out, but it was really, I don't know how I came across it, but it made all the sense in the world the second time around just to switch it. And this is, okay, so it's about you, and it's about safety and well-being. And we're all so tired of this. So I made it personal. I gave my personal story, and I'm new.
So Pat, just to narrow the point a little bit, when you say about you, meaning about you literally, like you don't want to get sick, this could be nasty, you're putting yourself at risk. And then secondarily, when you say others, are we talking their children? Are we talking more an elderly relative that they might be caring for or hanging around? Who's like, go down the list on you. What are you hitting? Give me the top 3 things.
The personal is about, what do I miss? What am I missing? We don't need to everybody knows about COVID. Everybody knows how devastating it is. What are we missing? Why do we want to make a change? What can we do? What can we identify in somebody's life that they really want, that they can't have right now? They can't go visit their elderly.
Oh, I see. Oh, okay. Yeah.
They can't go on the beach vacation without having to quarantine for 14 days when they come back.
Okay. So it's not just safety, it's actually quality of life. You can do more things once you're vaccinated.
Yep.
Kind of, sort of. Okay.
It was make it personal. What is it in that's going to make them move the needle? And I couldn't have been happier. Even if it was only 10 people I converted today, it was 10 more than I had yesterday.
Love it. Pat, can you send us a link to that article that you're referencing? Because we can circulate that. That'd be great. Thank you, Pat. Appreciate it. Other thoughts or questions? We got 10 minutes to go here.
First of all, Pat, that is fantastic on making it personal and saying, hey, don't take these cooties home to your kids. I really like that. One of the things that we did is we did T-shirts. And if you're wearing your T-shirt, that can be Jeans Day for you too. So hopefully they get washed between. I'd like to hear what other folks and what other states are doing for post round 3 clinic vaccinations for new staff and new residents and or people that have changed their minds. We're asking our state tomorrow in a meeting to consider allocating a portion of the phase 1 distribution to our long-term care pharmacies so that we can provide those post round 3 distributions. What's working for other folks?
So Scott, let me just ask you. So basically, to date, you hear nothing beyond round 3. As far as you know, there's no guarantee there's any vaccine provided for you. Is that right?
Correct.
Okay. You might be able to flip that to your advantage, of course, right? The scarcity argument might be a good one. Like, God knows if we're getting any vaccine anytime soon, we open up this to the general public, you might have to wait months before you could get this thing, right? There's a message there. Round 3 is your last chance.
We've
right?
been told you will not give, by the pharmacy, by the Department of Health, you will not give a first dose at your 3rd clinic.
I see. Okay.
Because there's
Well,
no
fair.
mechanism for them to get there.
But the same argument works before round 2, right? You could say this is your last chance to get the 2 doses here. It could be a long time. We don't know, right? I mean, that's a good message.
Absolutely.
That's good incentive.
Yep.
Yeah. But all right. But to Scott's question, who's hearing anything beyond round 3? Are you going to get vaccine, and when and how?
Federally, David, just because I'm pretty active with American Healthcare Association, is federally, they're really trying to work for the idea of almost an urgent care clinic situation. Because of the cold storage, it's kind of uniquely challenging for a primary care physician to just hold this vaccination for their either patients or what have you. So federally, that's kind of what they're talking about right now. Are we looking to this point in the future where if you can prove that you are a healthcare worker or you are a vulnerable adult or going into our settings, that you're prioritized at these somewhat urgent care COVID clinics?
Okay. But that's open to everybody, right? I mean, that's not just us.
Well, it would be if you were a healthcare worker or if you were that vulnerable population, you would be able to be prioritized.
Okay. Yep.
But that gets pushed to the state level, of course. You know, that federally, that's what's being pushed. But when it gets to the state level, we all know that it's all over the board.
Great. Anyone else hearing anything on vaccine after round 3?
Hey, Scott, this is Scott Hines with Medical Lodges. And in Kansas, what we're being told is that we're probably going to have to use the local health departments, and which are following the governor's guidance, and she's got a tiered rate. So anybody that's over the age of 65 would be eligible in really phase 2 here in Kansas. So all of our residents, any new resident that will come in past that 3rd round, we will be right now taking them to the local health department. And having.
And Scott, how about staff? How about staff that did not get vaccinated? Can they tap into that round?
Yep, they can. Now Kansas is doing similar to what Scott's doing in Oklahoma. We're trying to get some vaccines allocated. We're trying to get it to where it can come through our senior pharmacy, but we don't know yet. What we're being told now is we have to tap into county health departments.
Yep, that's great.
Obviously, this would get much easier using a non-Pfizer vaccine that doesn't have quite the cold storage requirement.
Yes. Yeah.
And there have been some of the Moderna vaccine, to my understanding, is not as exacting. So we're asking for an allocation of some of the Moderna vaccine to the long-term care pharmacies.
Yep. Yeah, I think all this changes 2 or 3 months from now, Scott, as we get into April, May. I mean, everything, J&J opens up. I mean, we get flooded with this stuff, but the challenge is just quickly, right? And by then the spread is really a race against the spread. So timing does matter quite a bit. Sorry, I interrupted someone.
But when we have turnover in staff and we have residents coming in all the time, that's what my biggest head scratcher is how are we going to vaccinate people that are coming in first day of employment and maybe say they could get the vaccination, but they're not, they're only going to be at 50% inoculated. So how do we get them the second? And then residents coming in, how are we going to get them vaccinated? Do they have to isolate until they can have the second vaccination? All these things are kind of playing out, but I'm just curious if anybody has any feedback on that.
Okay, so New York has announced what their plans are. It's McGurran Jewish Town in Long Island, New York, with CCRC and whole healthcare system. But and we've tried a lot of the great ideas out there, but just we were the first down in Long Island to get the vaccine, and as a result, Operation Warp Speed forced us to. We didn't have the luxury of all the education and we're already at the end of ours. We're by clinic 3 already. And as Jody just said, once you got the second, after the second shot, it's you're not eligible to give the first shot in clinic 3. New York State, so we are now at a point that we were able to, with our pharmacy partners, Walgreens and CVS, we were able to get a 2B and 3B clinic. Whole story and how we got that, but they're emphatic about not giving a 4th clinic. But the bottom line is we're now at mandation. And I actually just came from a meeting just prior to this. We're going to be mandating here. All the carrots in the world haven't gotten to us. David, once you're keeping your list there, our stats are 36% staff.
Wow.
No, close to herd immunity, 88% for the residents. And
wow.
What was said before, as far as families being very concerned and not wanting caregivers attending to them is a significant, and the PR element of all this is huge, and admissions we're greatly concerned about. But the bottom line is, as far as coming to the current question on the table, New York State is establishing what they're calling vaccine hubs. And like out in Long Island, it's through Stony Brook University, major hospital system. So what they're setting up is there are going to be like different zones or areas that people can go to while it's open to the public to be able to get, if they're in any of the classes 1A, 1B that have been opened up and now 65 plus in New York State, they are at the same time having a special lane for healthcare workers. So new hires, Jody, are going to be able to go to the special lanes. They're opening up at City Field, the Javits Center, Stony Brook, a few different places.
So sure, let me just, if I can, just because in the interest of time, I love what you're saying. So you're saying basically because the 3rd clinic is done, you're done with that, but this new distribution method, you're going to mandate. So you're going to say any employees that haven't been vaccinated, as well as new employees, you're going to go to this clinic at City Field or whatever, go to that lane and get vaccinated.
Correct.
When does that open? When does that start?
They're expecting by next week to have City Field open and Stony Brook's open already.
Are you going to organize your workers so you bring them all together, or is it up to them to go get vaccinated?
We're going to offer 3 times a week transportation to and from. They'll be paid for their time.
They'll be paying for their time, or you're paying for their time?
Paying for their time.
Yeah.
But as whoever was said before, the bottom line is we're going to, just like Atria, we're going to have a final date a little bit down the road, but everybody will have to be vaccinated. It's a condition of
built into the calculation. I'm sure this was hard for you. Do you have any guesstimate what percentage of your staff will leave you because of this mandate?
We were originally counting on 25%, but after seeing some of the others that have come along are now mandating, I think more and more systems will be mandating. At the end of the day, we're only counting on 8% to wind up ultimately leaving.
8% of your staff you think will leave you because of this, something like that. Okay. Yep. Wow. Interesting. So we see a trend towards mandation, I would say, seems to be. And I'll throw out one little anecdote. I heard from one company that decided to mandate, at least in one facility, 95% of staff took the vaccine. And he was counting on, he was ready to risk 20% of his staff leaving him. And he feels like it's less than that as he's rolling it forward. So one last question from anybody or comment.
I can just say I'm a little scared of universal mandate because I think it'll cause them not only to leave our buildings, but to leave the profession.
Yep.
Does anybody have 15 and 16-year-old workers, say in their dietary departments where they are able to actually work at that age? Questions about that they were not a studied class for the vaccine trials.
Luckily, we're Pfizer, and Pfizer did study 16-year-olds, and we only have 16 is our youngest age, but their families have reached out and we've educated, and the few that we don't have that many, but they have accepted the vaccine. And recently,
So Pat, hold on. Pfizer said it was okay. 16-year-olds did fine in the study.
16-year-olds were included in their study.
Okay.
And Massachusetts just yesterday listed 0 to 19-year-olds as the highest positive group of people right now. So when you say that to their parents, it didn't take long.
Yeah. Okay. All right. So I want to say we're beyond 5, so I want to end here as promised. So thank you guys. Some great feedback here. So again, we'll send out a link to this call if you'd like to replay it.